Hi, I'm Wes Grimes, one of the speech therapists here at Mercy Health Anderson Hospital. I'm here to give a very brief overview of what FEES is. We're going to talk today about the objectives of FEES, what we can gain from this procedure, and how it will benefit your patients. Obviously, it's very important to do instrumental assessments with patients who have dysphagia. We do not want to be too restricted with them as far as their diets, but we also want to identify aspiration and deficits when they occur. Okay, so what is FEES? FEES stands for Fiber Optic Endoscopic Evaluation of Swallowing and involves passing a very narrow scope along the floor of the nose. To do this, we use Surgilube on the scope. We do not do any kind of numbing spray for fear that it would affect the swallow. Therefore, it's passed into the pharynx for us to allow us to visualize the larynx and the swallow during the swallow, and also assess for any kind of secretions that are present at that time. So this is what it's going to look like. This is a little bit more of a close-up when we go in for a bird's eye view during the assessment, but this is what we're looking at. And as you can see, it gives a very different view than the modified barium swallow study that we're going to see later on. You can see the true vocal folds, the false vocal folds. You can also see the entrance into the esophagus in this view, which gives a lot of advantages. There's various different portable FEES equipment that can be used for this. And this is a modified barium swallow study. Obviously, a black and white picture. Again, you're not going to be able to see that. You're not going to be able to see the vocal folds from a perspective of seeing both vocal folds. You're going to be looking at it from the side. It has to be done with barium in radiology with a radiologist and a radiology tech. This talks about the difference between a FEES and a modified. Obviously, the advantage of a FEES is that it can be done in a patient's room. It does not have to be done in radiology. Also, it is going to be it's going to be able to go longer for patients who, for example, fatigue, and you need to see beyond that 5 minutes or so that is assessed for a modified barium swallow study. And here, this looks at the clinical differences between a FEES and a modified. Obviously, you can see here with the FEES, you can actually visualize the airway. So if we have patients, for example, with manifestations of laryngopharyngeal reflux, such as edema, you can actually visualize that and help identify patients who would need to be referred to an ENT. You can also see that reflux, but you can also get a much better view of secretions, as I mentioned earlier. Again, in false negative rate, we want to make sure that we're using an instrumental assessment to accurately assess someone. And silent aspiration, this slide talks about that, is a major problem. Up to 69.3% of people who chronically aspirate do so without a cough or without a throat clear. So that's why an assessment like this is so important. And this is going to show what we see when aspiration occurs. This is where we've actually used some food coloring, okay, in the liquid, and you can actually see in this case the penetration and the aspiration there in the airway. Also in this picture you can see secretions, frothy secretions that you would never see during a modified. So again, patients with poor endurance, patients who cannot tolerate transfer to a modified, patients who need to have a prolonged assessment because they fatigue, so on and so forth, they would benefit from a FEES versus a modified. And this can be done in, again, a patient's room. This can be done in ARU. It can be done for outpatients at the Diagnostic Center, both at Mercy Anderson and at Mercy Claremont. And again, also this gives a relationship between the therapist and the actual doctor, or the therapist and the nurse, because they can actually come in and see it. The nurse can actually give their medications right there at the bedside, which gives a lot of information. Well, I hope you enjoyed this presentation and found it to be informative. Thank you very much.